There are two kinds of polio, paralytic and non-paralytic. Symptoms for non-paralytic include fever, sore throat, headache, vomiting, fatigue, back pain or stiffness, neck pain or stiffness, pain in the arms and legs, muscle weakness and tenderness, meningitis, which is an infection of the membranes covering the spinal cord and the brain. These flu-like symptoms are obviously unpleasant and usually last 1 to 10 days. Sometimes the polio virus leads to the paralytic form, which is a very serious form. There are 3 different kinds of paralytic polio: spinal polio, brainstem polio, or bulbar polio. And last but not least, bulbospinal polio, which affects both your brainstem and your spinal cord. At first, the symptoms seem like non-paralytic polio, but within a week you will experience loss of reflexes, severe muscle pain, and of course paralysis of limbs, usually worse on one side of the body. When paralysis would meet the chest muscles, most patients would die because it would impair breathing. That is until 1927, when this machine was invented. It was called the iron lung and helped patients breathe. This machine was invented by Philip Dinker and Louis Shaw at Harvard University. It saved many lives. Post-polio syndrome usually occurs 35 years after having polio. Symptoms of post-polio syndrome include progressive muscle or joint weakness and pain, general fatigue and exhaustion after minimal activity, muscle atrophy, breathing or swallowing problems, sleep-related breathing disorders such as sleep apnea, decreased tolerance of cold temperatures, cognitive problems such as concentration and memory difficulties, and depression or mood swings.